All right, everybody. Good morning, good morning, good morning. Welcome to Florida Training Academy. I am Eunice. I will be your instructor for today, actually for this whole week. So it's a pleasure to meet you all. And what I like to do is I like to start off with my why. So the reason why I started teaching CNAs is because Miss Loretta, she's our weekend instructor. She came up to me and she said, "Hey, these babies are failing their test and we need to do something about it." I'm like, "Who is we?" And so we worked together. I developed the curriculum. She helped teach the skills. And so that's pretty much what we still do to this day. We still work together and we train people up. We're talking thousands and thousands and thousands of people because we started this 18 years ago. Our first students were transporters in the hospital because we were like, if we knew that if we can train the transporters, they had no medical knowledge, they had no medical terminology. We started off in the house. We didn't have medical beds and we didn't have the appropriate genitalia. We just went to the local store. So when I say grassroots, we have been grassroots. Never have tried to compete with a college. That is not our goal because I've worked in academia and I know the differences between what we teach and how we teach versus how they teach in colleges. And when I'm working in the college, I still have a large population of brown students who still gravitate towards me because we just teach differently. And so look, we're going to pass our examinations. I love all of my babies. It's small, but it's effective. And in 4 days, you should be ready to take your test and pass. So, welcome. Safety day door there. I don't usually use this as an exit on this side because you have to step up to get out. So if there's an emergency on this side of the building, there are two doors, one in the front, one in the back. I try to give you a break about every hour and a half. So whether it's a restroom break or if you just need to go next door to the convenience store to get you something, you're welcome to do so. We talked about the location of the restrooms and then help yourself to snacks at any point. So you're not just sitting in your chair. I don't do well sitting in my chair. And let me tell you, the first hour of this class is extremely boring. The reason why it's boring is because we have to go through paperwork and talk about the process. And then after that, we start moving around. So, and I'm just going to go ahead. We're going to do like a little round robin, is what I call it. As you introduce yourself to your class, because you're going to be practicing skills on each other, just like at the test. You're going to be practicing skills on one another with the exception of skills that involve nudity. If a skill involves nudity, you'll practice that on a medical mannequin. All right. So as you're introducing yourself, would you please tell your classmates your name and then the reason you're taking this course today?
Okay, well, my name is Dolores Buckles. Good morning, everyone. And I am taking this class as a CNA. I took the class in 1989, but just did not work in the field. I became a nail tech in the beauty industry. So I decided to go ahead and do CNA again and then bridge into LPN and then bridge into RN at the second half of my life because I know I'm not too far from 65, so I'll still be
But you're still young and
working.
energetic, and
Yeah.
and those younger students are just going to gravitate towards you. Number one, like you can cook, so they know they're not going to starve. And then you have a wealth of knowledge. So
Yes.
thank you for coming. All right, next, please.
Hi, good morning. My name is Nicole Richardson Way, and the reason I'm starting this journey, just like you, is to become a registered nurse.
Yes, 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 yes. So welcome. You have any schools in mind yet? Have you thought of anything? FSCJ, least expensive option. So it may be a little more challenging to get into FSCJ because they're competitive. But you're either going to get in fast and pay a lot of money, or you're going to get your GPA and everything up where it should be, and then go to one of the more competitive colleges, which the expenses are going to be less, but you may have a wait period. So you figure out what works best for you. Next, please. Good morning.
Good morning. My name is Amina Altidore, and my reason for starting, actually, my reason for being here is because I worked in the industry, and like you, I did it a long time ago. I didn't do the state though,
Mhm.
and I've been working in there and then going back and forth to have children get out and come back. Um, the reason why I started was because I was visiting from my country, and
Mhm.
one of my mom's friends said she needed to go away for a couple of days. Never done anything like that, and
Wow.
she said just come, I'll tell you what to do. It was an assisted living,
Mhm.
and the patient was the sweetest lady I've ever met, and it was wonderful, and the money was good, and I think I want to do this.
Yeah,
And I never turned.
and I mean, once you have these licenses, you all can do like companion travel, where like it's somebody who's elderly who just wants to go and travel, and they need somebody who has medical knowledge to travel with them. So it's so much you can do. Assisted living facility. So you're not just stuck working in the hospital. And a lot of times, especially our younger CNAs, you like to gravitate towards the hospital. You're going to get burned out fast, especially if you're trying to work in a hospital setting. So if you're trying to work in a hospital setting, home care pays well. It won't be as fun. You go sit there with Mr. Lucas all day and watch TV and microwave his food, but you can study, and it's 8-hour shifts. And either way, you're still a CNA. But I know y'all want to put on a nice uniform and go work in the hospital. I know. All right, next, please. Christian. Wonderful, wonderful. And so I heard you're a new mom. How's the baby? That's so good. Yes, yes, sir. Volume. Okay, and I'm talking pretty loud. Okay, well, they won't be able to sometimes. All right, so next, please.
Hi, my name is Deja. I've taken the CNA class once before. I do want to do travel CNA.
Yes,
Actually.
yes.
Of course, Miss Loretta recommended me. I had to do warnings.
Yes.
Okay. But yeah, I just want to do travel CNA. My family's in the medical field.
So, all right. Well, welcome, welcome. We'll talk about travel CNA. So, last but not least.
Hi everyone, my name is Alex Jackson. The reason I chose to do this class is because I woke up one morning. My mom's a nurse as well, and she just been watching me battle for years. Girl, you like everything, you got to pick one. I'm like, Mom, okay, I'm gonna do it. I'm gonna go back and get my BSN, but I think it'll be good if I do the CNA first. And I actually was looking on TikTok and I saw your videos a while ago, so I'm like, oh my god.
Well, let me tell you about TikTok, because TikTok is funny. The way I ended up on TikTok was because some of my younger students were like, Eunice, we want you on TikTok. And I'm like, girl, I'm on YouTube. Why do I have to be on both? And it's amazing, it's because you get a different audience from TikTok than you do on YouTube. So we're going to get started soon, but let's talk to you about travel CNA. So before you decide to become a traveling CNA, you have to make sure you've worked in the hospital, because they're going to give you the worst of the worst patients. It's like, oh, the agency or the traveling CNA or nurse is coming. So you don't get the sweet patients. You get the tough patient load. So you have to make sure you're ready for that challenge. And sometimes they're not as nice to you because you're the newbie there. You don't know where anything is. So you look like you're tough. So just know it's like, hey, you're gonna go to these different hospitals and facilities, and they're like, oh, she gets paid $40 an hour. She got this, and I'm gonna need you to rock it. I'm gonna need you to have it. Miss, oh yeah, you've been with Miss Loretta. You tough, yes, yeah. All right. Well, let me see how you all heard about us. So online, TikTok. So 2 people from TikTok, social media. All right. So let's get ready to rumble. So everybody, on your tables, there is a thick packet that is stapled. And that's what we're going to start off with. We're going to start with this packet right here. These are yours to write in. And that's Miss Dolores went ahead and she also bought a book. So the book this is more compact. That book is for readers. It has practice tests. It has a lot of things in it. So it's not duplicating the information. This one is just specific to the state of Florida, while that book is more global. So when we talk about skills, skills are standard. However, the way that Missouri may want you to provide toilet paper is different than how Florida may want you to provide toilet paper. So while our skills are specific to the state of Florida, test When you go to another state and you work, no one's going to be there with a clipboard saying, oh my God, she didn't give toilet paper at this point. So we're doing step by step. And so for some of you all who have experience, that can be a challenge because it's like, man, I know how to do this, but I need you to know how to do it for the state. And then once you learn how to do it for the state, then it's all on you, okay? Because after that, no one's just standing there with a clipboard deciding if you're going to pass or fail. So page 2. Page 2 has our QR codes for our Amazon, our book that's on Amazon. So if you decide later that you want to purchase a book, you can, or we have them here. We also have our CNA skills videos. So the videos we're going to be showing in class, there's your QR code for your skills videos. And if you want a practice kit so you can do all the skills at home, the last or the third QR code is for that practice kit. Page 3. Welcome and congratulations on your decision to attend our Certified Nursing Assistant Exam Preparation course. We specialize in preparing individuals for the written and the clinical portions of the Florida CNA examination. The directors and staff of Florida Training Academy have spent a tremendous amount of time preparing this course to facilitate you in passing the state examination. So we can't go and take the test for you, but we're going to provide you with all the resources you need so that you can take that test confidently. And if you make a mistake, I want everyone to say correction. Just say it for me. Correction. You don't have to be perfect. You have to be knowledgeable. Oops, I made a mistake. Correction. Your nurse is going to say, what are you correcting? You tell her what the mistake was, and then you can go on. There are some mistakes you can't correct, like if someone's laying flat and you put water in their mouth. Oops, you killed them. You can't correct that. So we're going to teach you like the safety, but then again, you don't have to be perfect. You're allowed to be human during this test. And if you're not good with speaking, we make you speak here. We make you talk here because at the test, you have to communicate with the person you're partnered with, but you also have to communicate with the nurse. And then once you pass your test, guess who you have to communicate with? Patient, the family, the nurses, the doctors, the social workers. So, attendance. This is a 4-day course. Come every day. Stop playing with me. If you need to answer your phone, you can go next door and answer your phone. You can step out the building. But what I won't do is if we're not on a scheduled break, I won't stop the class while you're on your phone. Cell phones, I didn't do it this morning. I'll go ahead and put your cell phone on silent or do not disturb. I'm not a fan of turning my phone off because we all have life issues. But if you'll keep it on do not disturb, I'd appreciate that. If you have a documented physical limitation and you need ADA accommodations, in our class, we really can't accommodate you like that because this is an accelerated course. When you take your test, unfortunately, the same rules apply. We had a student who broke her arm right before her test, and it was either you come take your test or you forfeit your fees. So she had to go take her test in a cast. She passed. She had to make a bed with one arm. She still passed her exam, but it's similar when you go to take your test because either you can do the skills or you can't. And they're not giving you any special accommodations. An accommodation they might give you is if you have like, I think it's like a learning disability, they can give you more time on your test, but you have to send in the documents. What I do is when I have you read here, I'm going to help you determine whether you need an audio test, the test is going to be read to you, or if you can just read the questions on your own. So that's like the easiest accommodation, is just to get the test read to you. Completing the course successfully. As with almost everything, your success greatly depends upon your motivation and effort. Students who are on time, pay attention, ask questions, and participate as expected should do well. We sincerely hope that you enjoy this course and gain valuable information for your future. All right, next page. Contact information. Now, you all have met Logan. So Logan and Tim are at the front desk. We have a small office. We have this big brand, and it's like 6 of us. So if there's a question that you need answered immediately, you can call the office because they're here 5 days a week. And Logan, as soon as I get a break, she'll be like, hey, I need you to answer this question. Or you can send an email. If you send an email, please allow 24 business hours for a response. Page 5 is our course overview. And Nicole, we'll start with you. Would you please read that paragraph?
To give you a better idea of what to expect and to assist you during your personal study time, the following is a course perform each day. The course will focus on demonstrating the proper technique and skills. Self-study and active participation are required in order for you to pass the state of Florida certified nursing assistant examination.
I know, and so I find it so funny because most adults, we're not used to reading out loud. And so now today, guess what everybody gets to do? Read out loud. All right, so the way that we break these down, so in brackets, pretty much today, we're doing everything from the first topic down to respiration. So we might as well just say vital signs. And then on day 2, we do another set of skills. Day 3, all the activity skills. So these are day 3 skills over here. And then partial bed bath on down would be day 4 skills. And so if you don't understand when we take our first break, I'll break it down. Just know that every day there's a new set of skills and we build upon the knowledge already taught. So once we teach you hand washing, we're not going back here and covering hand washing again. You're going to wash hands at home, build that skill, and now we're adding that to gloves, and then we add that to bedpan, and we keep building and building. Page 6. All right, so those testing fees. You should have received an email, and if not, we'll resend it. An email that gives you your orientation overview and a link on how to register for your Prometric CNA examination. Christian, I know we're responsible for registering yours. So on Thursday, before you leave, if you have time, we'll sit you at a computer so you can register for your test. And if someone else wants to, because what I don't want to do is, how should I say this? I like to keep you all as independent as possible. And so what I find is that if I start doing your applications for you, what happens when you want to fill out a job application? You know what y'all do. Y'all come, I'm not filling out your job application. I will send you a sample resume, but I will not do your sample resume. All right, so how much is the Prometric exam, everybody? $155. Go ahead and highlight that phone number and that website. So the phone number is 888-277-3500. And the website for Prometric is prometric.com/nurse aid with an E on the end. And then specific for Florida, /FL. So Prometric is the agency that the state has chosen who supervises or administers the CNA examination for the entire state. So it doesn't matter where you test at, whether it's Miami or Orlando. What we're teaching you is standardized education. You can go back to whatever test site you desire, and you're going to be able to pass the examination. Your exam is 2 parts. It's clinical, you have to do 5 skills. And then it's written, you have to answer 60 questions. We're going to get to that in your book. So that fee is $155, and that covers everything. It doesn't cover your background screening, and the cost of the background screening has gone up. It's now $95. So every time you renew your license in the state of Florida, when I say license, talking about your professional license, your nursing license, your CNA license, if you're a respiratory therapist, you now have to have a level 2 background screening. That's a national background screening. And what's the new fee on that, everybody? $95. If you want your background screening done while you're here, talk to Logan and Tim, and after class, they can have the machine and equipment set up so we can get your background screening done. Next is the Florida Department of Health. The Florida Department of Health is the agency that supersedes all of the healthcare professionals. So you're going to hear me say the Board of Nursing, the Board of Nursing, the Board of Nursing so much, but your license doesn't come from the Board of Nursing. Your license comes from the Florida Department of Health. Now they've stopped mailing licenses. Everybody looked at me. Yep, you're going to have to go on this link and you're going to have to print your own license. So don't be like, Nurse Eunice, how do I get my license? Because I have to do the same thing. I'm like, girl, they didn't send you a link. Let me help you. Let's just click on this link, enter your information, and that's how you're going to get access to your license. About 3 to 5 business days after you take your CNA examination and you pass, that lone link that I have there for license search, you should be able to search for your license and you'll get your license number. So on the day that you take your test and pass, you get 2 documents. Congratulations, you passed your written, you passed your clinical. You're a CNA, but you're a CNA without a license number. So you can, on your resume, you can put CNA. You can even start putting in applications. but no one's going to hire you until you have your physical license. But you don't have to wait to start interviewing. Basic life support versus CPR. As a healthcare worker, you have to know how to save someone's life. You have to know how to respond during an emergency. If you're waiting for the nurse, what if it's the nurse who's in cardiac arrest? So I need for you all to know how to perform CPR. So when you think of CPR, think of a sitter. Think of somebody who's in the house all by themselves. They're going to start with what they have, their hands. Maybe they have a Berry device where they can give breaths. So they're going to do chest compressions followed by rescue breaths. They don't have an AED. They don't have a team. They don't have a bag mask device. So that's the difference with BLS. So BLS teaches you CPR plus how to work with a team and how to work with additional equipment. Okay? So as a healthcare provider, even though your employer may ask for a CPR card, the type of CPR you need is basic life support or BLS. And we offer those classes, I think, on Friday evenings and Monday mornings. But if you're from out of city, you can go to heart.org, which is American Heart's website, and you can look for a BLS instructor in your area. Has anyone here already registered for their state exam? All right. Did you get any notification from them yet?
I did everything at once.
Okay. All right. So we got a few days. So this is what happens after you submit your application. Remember, we got a whole video that we've sent to you. And for people who are watching on YouTube, it's a video on YouTube that says how to register for your prometric exam. Okay, perfect. So now you got to start checking your emails, including your spam, because if you miss your test date, they forfeit your fees. So this is what we're going to have you do. You're going to check your bank account in 3 business days to make sure the funds have been removed from your bank account. So if you see the funds still there, your application has not been processed. You're going to have to give Prometric a call because your application will not be processed without a payment. You're going to schedule your digital live scan fingerprints with Florida Training Academy or whatever fingerprinting company that's FDLE approved is in your area. So there are fingerprinting companies throughout the state. So 2 weeks, Nicole, and get my names right. Dolores.
Yes.
Okay.
Dolores.
I've been calling Karen Dolores. I apologize. All right. So 2 weeks after your fingerprints and background have been completed, you're going to contact Prometric. They hate when you contact them. So on their website, there is a way where you can click on the link and do an online search for your application to see the status. But if you give them a call, they'll be like, has it been 90 days? I want you to say, I think so. And inquire about your testing date because you have no control over your test date. You have to take whatever date they give you. And if you need to reschedule, you have to do so 5 days before your test, and they still charge you $25. So pretty much it's whatever. Everybody's okay? All right, so it's whatever test date they give you, or you need to call a change. So you being proactive and communicating with them is going to help you select the test date that best fits your schedule. Okay. And they hate this too. Keep calling every week until you have your exam date and location provided to you via phone. For example, she said she's calling. I need you to follow your money. This is the money that you've actually put down. So you paid $155. You have a right to call. So let's say that you want to take your test, Karen, in Orlando. And you call and they're like, hey, our testing location in Orlando doesn't have a test date for 3 months. Because sometimes it's based on the nurse's schedule. You would say, what's the availability in Daytona? What's the availability in Jacksonville? Because they could have one the next day in another city. So when you pick up the phone and call them, you have more control over your test date and your test location. Right? Do not wait for your admission letter to be emailed to you. Pick up the phone and inquire about your exam date so that you can pay to reschedule if necessary. The longer you wait to call, the less control you have over your test date, and you may be charged additional fees. If you miss your exam appointment, all of the fees paid are what? Forfeited. So you cannot miss your test date. You miss your test date, goodbye dollars. Okay, so now we're going to cover the examination process. We're on page 7. We kind of talked about some of the things. You're going to reschedule at least 5 days before your appointment. You're going to arrive on time, just like you all came here on time today, the same exact thing. At the test site, though, your test starts at 9 a.m. sharp. So if you walk in at 9 a.m., you have forfeited a portion of your monies paid because your test started at what time? 9. So you're going to trick your brain. I want everybody to write on page 7. Your test starts at 8:30. She put your test starts at 8:30. I need you at the door at 8:30. Candidates are expected to play the part of the resident for other candidates. You will read specific instructions to explain what is expected of you in playing the role of a resident. Failure to bring proper ID or failure to dress appropriately will result in the forfeiture of the exam fees, and you will have to reapply for the examination. Children are not allowed at the testing site. The least expensive uniforms in our area, you can just go to City Trends. And it doesn't matter what color uniform you need. So what color uniform you want to wear. If you find something that looks nice on your skin for $12, go ahead and get it. Because the problem is that you all go out and you just like, hey, I'm going to be a CNA. I want to get 5 different uniforms. You spent $200. You get a job at Memorial Hospital, you have to wear teal. She looked so disappointed right there. Alec was like, man. So just get at least one medical uniform to take your test in, and then after that, wait until you are hired so that you know what color uniforms that facility requires. You're going to need 2 forms of identification. I like to say your driver's license and your bank card, because your bank card went through a process. It has your name on it and you have to sign the back. Otherwise, it can be your social security number, your social security card, but you have to sign that too. Right? So is there anyone here that does not have 2 forms of ID? Passport, driver's license, military ID. The address on your ID does not have to match, because you could have moved. So as long as your photo is good and the ID is current, they're going to accept that. All right, page 8. Skills test, your clinical skills test. We told you to arrive 30 minutes early. Your admission letter is what's going to be emailed to you, which is why you have to check your emails. You want to have that printed or at least have it on your phone. Identification required. We talked about the 2 valid pieces of ID. What to wear, if you'll highlight that, it's in the center of the page. Everybody, what are you wearing during your test? Medical uniform. What else? Socks. What else? Athletic shoes. And you don't have to wear a mask any longer, but at least take one, because their website changes. One day it'll be like mask is required, the next day it won't. So at least have one in your vehicle. Okay. Candidates taking a clinical skills test are required to wear flat, non-skid, closed-toed shoes. It is recommended a uniform or scrubs be worn on the day of testing. Candidates may also either wear or bring a watch with a second hand. However, our students are encouraged not to wear a watch to avoid possible recontamination during the hand washing skill. So during the hand washing skill, number 1, I have sleeves on. So I'm going to have to make sure my sleeves are up as I'm walking towards the bathroom. I'm going to take this watch off, because if I cannot wash my wrist during the hand washing skill, I fail hand washing. Anytime you have to tell time at your test site, there are clocks on the wall. If you have to take the pulse or take the respiration, you and your nurse are going to be looking at the clocks that's on the wall. Plus, this watch is missing a second hand. So I know how we all like the new fancy watches. These watches are not appropriate for patient care. Go ahead and show out for us, Nicole. Go ahead and raise. Go ahead, would you raise your arm up? You need an old-fashioned watch with a second hand. So, dang, I got to do better. All right. So, any questions on what to wear? All right. If you feel like you must take your watch, just put it in your pocket. Page 9. It is recommended that purses not be brought to the testing center, as access to purses will not be allowed. But we do understand that some of you all are catching Ubers and Lyfts. So the testing center is going to have an area where they can secure your items, especially your phone, because no one's traveling just without anything. All right, so taking your exam, if you leave the testing room while an exam is in progress, you must sign out and sign in on a roster, and you will lose exam time. So everything's timed. We're going to get to that in a few moments. You will not have access to any personal items during the break. You are not allowed to use any electronic devices or phones during breaks. No guests, visitors, children, or family members are allowed at the testing center. Candidates who engage in any kind of misconduct or disruptive or offensive behavior will be dismissed from the examination. If dismissed, exam results will be invalid and the details of the misconduct reported to the Board of Nursing. I'm gonna need for y'all to behave. Don't be giving those nurses any attitude. All right, let's go to page 10. Now we're getting to the nitty gritty. First, we're going to talk about the clinical skills test. So the computer will randomly select how many skills?
3.
So it's going to be 5 total, but it's going to be like 3 topics. So it's going to randomly select 3 skills for you to perform during your clinical skills exam. Additional skills that will be tested will be the use of gloves and proper hand washing procedures. So that makes it 5. So example, so if a skill is bedpan, you still got to wash your hands and put on gloves. Okay. You will be allotted a minimum of 31 minutes up to a maximum of 40 minutes to perform your skills. At the completion of your examination, you and your partner will switch roles and they will perform their skills. If a skill involves nudity, the role of the mannequin will be played, the role of the resident will be played by a medical mannequin. During your test, you're going to hear the word resident, 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 resident a whole bunch. So a resident versus a patient. Who knows the difference? Go ahead. It's a safe learning environment. Take a guess. You are absolutely correct. So she said a resident is someone who's in home health, maybe hospice, assisted living facility. So when you have a resident, that means that you're in their residence. You're like, so even if it's an ALF, that's their room, that's their home. Versus a hospital, now that's like a patient because they're just visiting there. So when you take your test, do not act like you're in a hospital. They keep using the word resident for a reason. You're inside of this elderly patient's home. So your test is not geared toward kids. But that does bring up a concern. As a CNA, you can work anywhere where there's a nurse. So if you decide that you want to work with kids, but your test and your education was geared toward adults, what you're going to do is before you go and interview at a children's hospital, is you're going to go back and do some more research. You have to go back and study more because children, what kind of respiratory issues do they have? Asthma. If a child goes into cardiac arrest, it wasn't because their heart stopped. What stopped first? Their lungs. They stopped breathing first. They drown. So you gotta, and then the vital signs are different. So if you want to go work with children, you can, but you're going to have to study because they're not asking you about strokes. You know, kids can have strokes, but it's really rare. Okay. All right, so the written test. The written test is taken on a computer and consists of 60 multiple choice questions that evaluate your overall knowledge and skills in providing safe and competent care. The test has 50 scored items and 10 unscored items. So that's 60 questions total, but only 50 have weight. How many minutes will you have to complete your written test? 90 minutes. So make sure you're highlighting stuff because I can guarantee tomorrow you're going to come in and say, hey, Nurse Eunice, how many skills and how many minutes? And be like, turn to your highlighted page 10 and tell me what you have there. All right, so the audio test. The written test can be taken in an audio format. That means that you can have a headpiece that only you hear and the test will be read to you. During an audio test, you'll be able to hear the questions read to you while reading and answering the questions on your computer. You may replay questions as many times as needed. The audio administration may be helpful for candidates who have a reading disability, limited reading skills, or those who consider English as their second language. Candidates who would like to take the audio test should select that option on the application form. So it's not more expensive, it's still $155. You just have to select the correct option. Any questions before we move on? Oh, you all are making this overview really easy. I'm loving it. All right, page 11, advice to help you pass a written examination. Medical billing and coding. But when I took my medical billing and coding course, it was a 5-day course. So a course that most people take for 10 to 12 months, I took in 5 days. Because when I don't understand something, I know to go look it up. So if you want to save your time and not pay these people all this money, like how y'all took this class, when you go home and you have a question about medical traction and you're like, I've never seen medical traction. Go to your phone, type it in, and then click image. And you're going to see somebody who has had a leg surgery and their leg is up in the air with a pulley and a weight system. That's medical traction. What does a CNA need to know about medical traction? Don't move the weights. The doctor has that leg at an angle for a reason. That's how they want it to heal. So if you go in and you move the weight, you move their extremity. All right. You have homework tonight. Yeah. Your homework tonight are 25 of the practice test questions that are on your table. So everyone should have this packet. You have 25. There's an answer key on the back. If you look at that answer key in advance, you are cheating yourself. All right, so if you look at the answer key that's on the back, you are cheating yourself. Tomorrow when we come in, we're going to go over the first 25. And if you do have a question, we're going to discuss it at that point. Once you've completed your class, I want you to practice 2 to 3 skills per night from start to finish. So that's from introduction all the way to the end, washing your hands. Doing so helps build muscle memory and confidence so that every step becomes automatic during the CNA skills exam. When you're taking your exam, do not second guess yourself. Do not change your answers. Always select the option that will be the safest for you and those in your care. So the two who are going to have probably it won't even be a problem, just a challenge is going to be Karen and Dolores, because they've been doing this before. And so they're used to doing things the fast way, not necessarily the safest way. And so if you have to help with wound care, this is not something the CNA is doing. I'm just giving an example. If you have to help with wound care, and there's an option that says you're going to change your gloves, you're going to come in, put on gloves, wash your hands, put on gloves, and then you're going to remove the dressing, and then you're going to change gloves, wash your hands, change gloves again, and then you're going to pull on the new glove, the new dressing, excuse me, and then you're going to take off your gloves and wash your hands again. That sounds like a lot of steps, right? But it was safest for the patient. Y'all not doing it that way. She's laughing. Y'all are like, oh, all right, same gloves. Put the new bandage back on. No. So when you take your test, just slow down and think about real world when you have 15 patients and you're rushing versus for your test. Perfect care on one patient. You have all the time that you need. What is the role of the nursing assistant? Can you all give meds? No. There is a course that you can take, but you're not there yet. There's a course you can take in Florida to give medicines, but you have to be a CNA for a year if you're doing it in a nursing home. Some of them will allow you to do so sooner, but to me, they're setting you up, because if you make a med error, that gets reported to what board? The board of nursing, who's going to now probably not give you your nursing license because you're operating as a nurse without being a nurse. So if somebody wants you to be a med tech and the money isn't right and you know you're going to nursing school, I would know I'm just going to be a CNA. I appreciate you. I appreciate the opportunity. Learn how to prioritize care. Taking a resident's vital signs may be more of a priority than giving someone a bath or keeping them comfortable during an emergency situation, such as a fall. So we're in Mr. Lucas's room. He's on the floor. You're by yourself. You and I are the only 2 caregivers in the entire nursing home because the other CNA called out. You're in room 1 and I'm in room 30. Y'all like, oh Lord, Alec, it's going to be like that some days. So what do? How do you get help?
Say that again.
How do you get help? You're in room 1, I'm in room 30. We're the 2 caregivers, night shift. Someone help us out. How do we get help? He's on the floor. You're going to call for help? Via what device? How? The call button. So the call button is a slow way to get help. The call button goes to the front desk. Ain't nobody at the front desk because there's only 2 of us tonight, and I'm in room 30 and you're in room 1. So you can press that button, but I don't know if you've ever been in a hospital and you've been waiting for someone to say, how can I help you? And 5 minutes later.
Can you stand in the hall?
You can stand in the hall and do what?
And say you need assistance or ask for help.
So you can scream help. Don't scream nurse, because we're kind of tone deaf to people screaming nurse all the time. But when you scream help, maybe that lab person just came into the building, because you don't care what their title is as long as they can help you and maybe go get that nurse for you. There is a panic button above the bed. So that's the code button. So if there's an emergency, that button is what alerts the whole hall. So we know when we hear that sound, oh, I don't care what room you're in, there's an emergency somewhere. That's where we're heading to. Is everything okay, Jay? Awesome. All right, so now everybody's in the room. You stayed with him. Great job. Why didn't you try to get him up by yourself? She says she's too little. You can cause more damage, and the nurse needs to come in and do an assessment. So even in like home care, I'm sorry, your patient's on the floor, you may have to call 911 because they need to be assessed. We don't want you to get them up and they didn't have any pain because they were laying on an injury. And as soon as you get them up, they're going to be like, oh, she hurt me. No, Mr. Lucas, you were already hurt. I was trying to help. So sometimes you trying to help without assistance is a bad thing. So now we're going to use a team lift when we get the patient back in the bed. And I forgot to tell you, he also had a pool of urine. So that's what happened. He slipped and fell on his urine. All right, so now he's back in the bed. What's the CNA role?
Take care of the patient.
We just read it. I need for you to learn how to prioritize care. Y'all are trying to clean him. Take the vital signs. Why do you care about the vital signs for somebody who just fell?
Because his blood pressure could have went up or.
Thank you. And then once we get that settled, that's when the nurse is in the room. You can leave because someone needs to stay with this person. You can leave to go get your towels and stuff, and then we can hurry up and wash them up. But I'm going to have to leave once you come back to call the doctor to get the x-rays and the pain medicine. So y'all understand that we can give the bath later.
Yes.
All right. And now after all that, what do you have to do? What's the next check mark? Don't forget to document. If you didn't document it, you had no proof that it was done. What are you going to document? Before the vital signs, what did you see? What was the incident? Him on the floor. So you don't want to say you saw the patient fail. Because if you document that the patient failed, they're going to be like, why didn't you stop him from falling? So patient found on the floor. Document what time they were found. Nurse notified. Assisted to bed. Vital signs, such and such. Patient was incontinent of urine. What does incontinent mean?
He's not able to control.
He wasn't able to control it. So like the incontinent briefs and the incontinent pads, those are the pads that we put under someone for leakage. So this person was incontinent of urine. They were given a bath. And now how are you going to leave those side rails? Up, side, patient left in bed with the side rails up. What are you going to leave in their hand? The call button. And make sure at some point you indicate that nurse and her name. His name, okay? Because you're telling all this to somebody. It's okay to put in the chart that, Nurse Susie in the room with the patient. Okay. Any questions on that? All right. The goal is to not have them fall, but if they do fall, you have a role, and then your role doesn't end when they're in the bed, because if you don't document everything that happened, it's going to look as if you were trying to hide something, and we could be liable. All right. How many of you all have testing anxiety? I'm so proud of you all, girl. You're going to be fine. You ain't got no test. Your mom's a nurse. All that testing anxiety, you're going to be okay.
I do.
So the way that you can overcome your testing anxiety is to, one, study in small increments. So you'll practice some skills, and then on top of that, you'll answer a few questions each night. And I want you to develop a study plan. So let's say you get a test date, and your test date is 21 days away. I want you to segment it out where 5 days per week you practice skills 1, 2, 3, 4, 5, 6, 7, 8, 9. You're practicing skills every day. Do about 25 questions. By the time you get to that test site, there's nothing they can give you that you haven't covered already.
So we're doing what?
Try to do 3 skills a day, 2 to 3 skills a day. And the last one I need you to highlight, because if you're going to fail this exam, that's the reason you're going to fail. When do you wash your hands? Before and after. And you have 3 skills. So that means that if your nurse is feeling a little funny that day, she can literally require you to wash your hands 6 times. Because in the real world, you'd be going into one room, washing your hands, providing care, washing your hands, going into the second patient's room, repeating that process. So when you take your test, even though you're partnered with the same person, treat each skill as if you're entering a new patient's room. What do you do before you enter a room? Do you just walk in? You have to knock, okay?
Quick question. So
Yes.
at the exam, will the nurse
Mhm.
specify whether she wants you to do both after and before?
So what has been happening commonly in our area is that after your first skill, so she's watched you wash your hands twice. He or she will say from this point on, just tell me when you wash your hands, and we consider your hands clean. So you don't have to physically do the skill, but you have to verbalize it. I've also heard that at other test sites, the nurses made them wash their hands 6 times. So y'all pray for grace on the day of your test, okay? Indirect care measures. As you are performing the skills on the following pages, you must be mindful to address standard precautions and infection control measures. Also, the resident's right to comfort, privacy, and safety must be maintained throughout the procedure, aka the skills. So, standard precautions and infection control measures, you're going to treat all patients as if their bodily fluids are what? Contaminated. I don't care how sweet little Brenda looks. When little Brenda reaches up and she pats you on the face, she was in that bed scratching and coughing all night. So I don't care. Everybody's germy, okay? Hand washing is the single most important procedure to prevent the spread of bacteria and germs. You must begin and end each skill with clean hands and must wash your hands after the gloves are removed. So, what is a bacteria that hand sanitizer doesn't kill? Ooh, it's something that causes diarrhea. Beyond E. coli. So this one, E. coli, if hand sanitizer, if it's just E. coli, we should be okay. It's C. diff. Clostridium difficile. We just say C. diff for short. So that's when we put a patient on contact isolations. And it's going to, and you're going to know it because not only is it just lots of diarrhea, it's foul smelling diarrhea. And that means it's contagious. So when you're performing your skills and your legs are touching the bed, and I say, no, you got to start all over again, correction, it's because in the real world, you're going to be contaminating yourself, going into another patient's room, passing that to another patient. You're going to go home, pick up your child. Now your house is sick. So you shouldn't be touching anything. Nothing touches your uniform. You want to make sure that you keep those infection control processes, including hand washing when someone has C. diff. For the promotion of resident comfort, what is the last sense that leaves a dying patient? Hearing. So when you're performing the skill on the medical mannequin that's not going to respond to you, the nurse responds on behalf of that medical mannequin. So if I'm performing the skill on you all, it's easy. Hey, are you in any pain? Yes or no. But when someone is unresponsive or unconscious, how could you determine if they're in pain? Or maybe they're nonverbal. How do you know if they're in pain?
Look at their eyes.
Okay, you can look at their eyes, maybe some tears. Go ahead. I can't hear y'all. I gotta talk louder. The body language. So what's going to happen if someone's arm or their leg hurts? How are they going to respond? We call that guarding. They may start guarding. What's going to happen if they have a heart monitor or if they have a vital sign machine? What might happen?
The pulse go up.
The heart rate, the pulse is going to go up. And then what's going to happen with the blood pressure? It'll go up also. So literally, while you're performing care on somebody and you turn them and you're like, oh, wow, his heart rate went up. What does that mean you probably need to do? Turn them back. And get who in the room? The nurse, okay, because something's going wrong. Promote resident rights. Residents have rights. Allow the resident to decide what they want to wear, what they want to eat, and how they'd like to have their hair styled, etc. No two people are alike, so do not think that what is acceptable to one person is acceptable to all. Allow those in your care to actively participate in any decisions regarding their care. The goal is to keep them as independent as possible for as long as possible. So if I follow behind you and you did everything for Miss Reagan, and I come and I'm like, oh no, Miss Reagan, here's a washcloth. I want you to wash the parts of your body that you can reach. How is she going to feel about me? You did everything for her. And I'm in there trying to help her to be independent. The other CNA did everything. And I'd be like, oh, she did? Well, she off duty right now. So you want to encourage them. If someone has a stroke on one side of their body, what's going to be special about the side of the body that's affected by a stroke? It's not going to rise, so it's going to be kind of limp. But the side of the body that does move, all right, let's give you this washcloth. Let's go ahead and wash your face, especially with men. If you don't want to clean our genitals, okay, here's a washcloth. Go ahead and wash that for me, and I'll get the areas that you can't reach. Promote resident safety. Providing a resident with a call bell before leaving their bedside will help to prevent a person from getting out of bed without help. Placing the bedside table near the resident with a cup of water may also prevent a fall or injury to a resident because he or she does not need to walk across the room to get a drink. Another example is to make sure that if you elevate the bed to perform a skill, what should you do afterwards? You lower it back down. Here's our cheat for your test. Whatever height you find that bed, leave it there. Because that prevents you from failing from forgetting to lower the bed back down. So it may hurt your back for a few minutes, but it's just a test. I know somebody out there is going to be like, well, don't do that. You all have enough to remember. When you're in the real world, if you leave the bed elevated, those beds usually have sensors. They have, it's going to light up if the bed is up. The beds at your test sites don't. So if you look at our beds, and we'll be over there shortly, our beds are semi-automatic. So if you're taking care of a resident, they can just have a regular traditional bed. So don't think when you're at the test site, they have these fancy beds, because it's not required. All right, so never leave a resident who is at risk of injury alone. Stay with the resident and call for help while you're with the resident. And if there's an emergency, do you press the handheld button or do you press the button that's on the wall? The one that's on the wall. We have about 15 minutes left to our first part of our orientation before we get to skills and your first break and then skills. Let's go through our greeting. So at the very bottom of 13, I want you to highlight the acronym HCC. The bottom of 13, highlight the acronym HCC. You see it? It's in that graph. It's in that table. Yes, ma'am. What does the H stand for? Hand washing. The first C, curtain, and the last C is the call bell. So when you walk into a resident's room at the test site, this is what I want you focused on. They're not going to have identification bracelets on. The beds are automatically going to be locked, so they're not trying to set you up like that. So when you walk into the room, you're going to introduce yourself. So we're going to practice a skill. We're going to start with number 1. Come in. Hello, Mr. Lucas. This is somebody you've never met before, so just make up a name for your test. Hello, Mr. Lucas. My name is Eunice, and I'm your CNA today. I am here to take your vital signs. Is that okay? So, hello, Mr. Lucas. My name is Eunice. I'm your CNA. I'm here to take your vital signs. Is that okay? Why do we have to ask, is that okay? And they have a right to refuse. At the test site, no one refuses. At the test site, if your partner refuses to have a skill performed on them, the nurse is going to warn them. The second time, she fails them. So if you don't want your teeth brushed during the test, you paid $155, you're about to be excused because you have to participate in the skills. Okay? All right, so now that Mr. Lucas has given you permission, what do you do before you touch him? Go wash your hands before touching a resident. That's a failing point. So that's why in HCC, I put the H first. Now, someone else is going to be like, oh, Eunice, you washed your hands and then you went back and you touched the curtain and the call bell. You got contaminated. I'm going to be touching a whole human. So if I'm worried about contamination, what would I put on my hands? Gloves. I need you to wash your hands first because that is going to fail you if you forget to wash your hands. Christina, the Christian, stay up. Don't you be falling asleep on me. I told you the first hour was brutal. Stand up. All right. And then once your hands are clean, you can provide privacy by pulling that curtain. If you need to apply gloves, like these steps, it doesn't matter what order you do them as long as you wash your hands first. And then you're going to perform the skill. We'll practice this in a few moments. Page 14 is the exiting procedure. At the bottom of 14, I want you to highlight HCCD. And what does the D stand for? Documentation. If you did not document it, you have no proof that it was done. So after you perform your skill, you want to make sure that you leave the area clean and tidy. Neatness counts. You're going to place the call bell where? Do you place it on the bedside table? Directly in their hand. And what question do you ask? Is there anything else that is needed? So that's going to save you a lot of steps, because some of your residents or patients, as soon as you leave the room, they call you back in the room. And the way you're going to prevent that is before you leave, hey, is there anything else that you need? Because I'm going to go check on my other residents. And it may be 30 minutes before I come back this way. So you get everything done for that resident. Do you want to leave them with the curtain closed? No, not unless they request it. At test site, they're not going to request that, because you want to make sure that you don't leave them isolated. So you open the curtain back up. You're going to discard your gloves, and once your gloves are discarded, you can wash your hands. Once your hands are clean, you can then pick up your pen and document. Before you exit that room, I need you to pause, and for 5 seconds, you're just going to look. And I want you to say HCCD in your head. It doesn't have to be in that order, but H, how many times do you wash your hands per skill? 2. If you didn't wash your hands twice, what do you say immediately? Say it again. Correction. 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 Let me go wash my hands. Now, if you messed up at the beginning of the skill, I'm sorry. I don't know if it's that much grace. But if you forgot to wash your hands at the end of your skill, correction, let me go wash my hands. The C, curtain. Let's say at the end of your skill, you realize you never closed the curtain. Don't freak out. What do you say? Correction. What are you correcting? I forgot to close the curtain. When would you have closed the curtain? At the beginning of my skill. Now, if you're giving a bath or something and you didn't close that curtain, that's going to be weighed more heavily versus if you were just walking someone, ambulation skill. So that's why we try to get you in the habit of HCC. You go in that room, you wash your hands, you close that curtain, you remove their call bell. So the last C is call bell. At the end of your skill, where should it be at? In their hand. And during your test, you don't have to document every skill. In the real world, we document everything. During your test, there are only 4 documentable skills. I won't tell you what those skills are right now. What I'll say instead is that if they require you to document, they're going to give you a documentation form. So if your nurse gives you a documentation form, pause, fill it out before you say that you're done. And now that you said you're done, you have 2 more skills left. How do you start your second skill? I went knocking. Got to start all over again. Introduce yourself all over again. All right, it'll make sense in a moment. We're going to go ahead and practice. I'm going to give Nicole the remote. So Nicole, right now, the remote is going to substitute as our handheld device, or call bell. And when I knock, I want you to say, come in.
Come in.
Hi, good morning. My name is Eunice. I'm your CNA today, and I'm here to take your pulse. Is that okay? Before I begin, I'm going to go wash my hands. I haven't taught you the hand washing skill yet, but you're going to learn that. Now that the hands are clean, I can come back and I can touch her because I'm not introducing any germs to her. May I take it out of your hand? Are you having a good day so far? So I did an H. I did a C. What's another C that I have to do?
The curtain.
The curtain. Let me provide some privacy. Now I'm going to do my skill. I have the number in my head. I was taking her pulse. When you don't have gloves on, you can pick up your pen and document right away. It'll make sense when it makes sense. I'm done with the skill. What do I do now? I'm standing right next to her. What could I do? Give her the call bell back. Here's your call bell. Do you need anything else? If you do have any more requests, just go ahead and press the button and I'll be right back in. What do I do now? Wash my hands. So I did a C and I did a H. What do I do now? I got to document. What else do I need to do? Open the curtain. Do not say you're done. Stand there for 5 seconds and say H, C, C, D. Hand washing. Did I do it twice? Yes. Curtain. I closed it. I opened it. Yes. Call bill. I took it and I gave it back to her. Yes. Documentation. Did I document? Yes. Now you can say, I'm done. How do you start your second skill? Y'all got it. Y'all are ready for your first break. All right. All right. I'm turning off this mic. And then you all Testing, testing, we're back. Can you all hear us? All right, put some thumbs up in the chats. Testing, testing. So this is what I didn't show you all last time. I call this the hamburger. It's exactly what we mentioned before. So whenever you think of your skill is divided into 3 portions. Your skill is divided into an introduction, which is a top bun, because I watched SpongeBob and his burgers that day. And then the central portion is the meat of your skill. And then you have the base. So I want you to take a photo of this, or I want you to go ahead and draw it. Yes, dear. Yes, come on. He could not remember the Krabby Patty formula. He could not remember the order. All right, so when you enter the room, HCC. The meat of your skill. It's going to be hard for you to perform your skill if you don't have supplies. Your nurse will not gather your supplies for you. You are responsible for gathering your own supplies. If you forget a supply, you don't freak out. What do you say? Correction. Go back and get your supply. More than likely, if it's a skill that involves you moving a patient or food or fluid going into their mouth, they are not going to be in the correct position. So what skills do you think will require someone to be sitting upright? Eating, drinking, brushing teeth. So when you get into the test site, they're not going to be sitting upright. It's going to be the opposite. They're going to be laying flat. Because if you put water in their mouth while they're flat, that's an instant failure. Because what's that A word? Aspiration. So aspiration is when instead of the food or the fluid going into the stomach, it goes into the lungs. And we sit them up to prevent aspiration. And then you perform your skill. And then after your skill, how do you close it off? HCC D. How do you know if you have to do the D? What will the nurse give you? A documentation form. Oh, you all are smart. I'm going to make this an easy class. Your skills card is a piece of paper. And it's going to have your 3 skills on them. And so skill number 1, you treat it as if it's room number 1. Skill number 2, you treat it as what it's room number 2. And then skill number 3 is room number 3. Before you go into someone's room, what do you do first? Knock. You're going to knock. And then you're going to do your HCC. You're going to perform your skill. And at the end of your skill, you HCCD. And I'm just going to lay this out on the table over here so you all can take a photo of it whenever we go on our next break. Now it's time to talk about the vital signs before we start learning how to perform vital signs. So you now have another staple packet. It's the one that says aspiration. So it's a small staple packet. You'll go ahead and open that one up. And I think it's the center page. Let me see. Nope. One more page. Last page. So the last page of your aspiration packet. The center page is your documentation form. The last page is where we need to be. Now, I'm going to be honest with you. I created this when I could see well. So if I had to read this now, I'd be struggling. So just bear with me. Before we go to our vital signs, we're going to focus on our different positions. Because we don't speak in regular terms. Like I'm not going to tell you in the hospital to lay somebody flat. Don't ask me why. I'm going to say put them in what position? When they're on their spine, what is it called? Supine. So take the U out. When they're on their spine, they're in the supine position. During COVID, we started putting patients on their stomachs, but these are patients who have heart monitors on. They have a pulse ox on their fingers so we can monitor their hemodynamics. If your patient doesn't have any monitors on, do not put them in the prone position. When they're prone, how are they facing? Face down, which means you can't see what move. They're breathing, their chest. So that's why we had them on all those monitors and in the prone position. So you're rarely going to see a patient in the prone position if it's not an ICU setting or if it's not some type of with medical supervision right there in the room. You have two different types of Fowlers, even though one is only shown on the image. Fowlers is an upright position. You have semi, which is reclining. So when someone's kind of like sitting back, it's not safe for them to eat, even though they're upright. They're like, we'll say 30 to 60 degrees. That would be semi-Fowlers. High Fowlers is how most of you all are right now. You're sitting up 90 degree. That would be high Fowlers. If someone is vomiting, do you want them in semi-Fowlers or high Fowlers? High Fowlers. You want to get everything up. After you fed somebody, so you put them in high Fowlers for the feeding. But after the feeding, do you put them supine or do you put them in semi-Fowlers? Semi. Why can't we just lay them supine? It can come back, and we call that perfect. I'm hearing the terms. That could be acid reflux, so they can regurgitate. And so if they regurgitate and they're laying back, that means they're going to do that A word, which was aspirate. Your patients don't like sitting upright. They do not like sitting upright. It hurts their back. Hey, Logan, would you close that door, Logan? I'm sorry. Would you close it? So they don't like sitting upright. They're going to say, oh, that hurts my back. What are you going to put behind their back? A pillow, okay? So Miss Lucas, I understand that your back hurts, but I have to sit you up for safety. Let me put this pillow behind your back while I feed you. And then after we're done feeding you, that's when I will recline you back for how many minutes do you think? It's okay if it's not perfect, Logan. About 30 minutes. Give their food time to digest. Trendelenburg. What's special about the Trendelenburg position?
The head is a little bit lower than the feet.
Okay. So while we put someone in Trendelenburg, where are we forcing the blood flow? To go to the brain. So that one's not for swelling of the legs. So that means I'm trying to take the blood from their legs to their brain. They were dizzy. So if it was just swelling of the legs, you would just elevate the legs. You all cannot do Trendelenburg without a nurse telling you to do so. At the foot of your bed, they're going to have different controllers, and the controllers will let you put someone in Trendelenburg. It's going to let you put them in a chair-like position when you have a fully automated bed. So sometimes for some patients, we don't take them out the bed to put them in the chair. We can just hit the chair position on the bed, and it's going to sit them straight up. How often do you have to turn your patients or reposition them? Every 2 hours. Or PRN. What would be a reason that means as needed? What would be a reason that we have to change their position before the 2 hours? What could they be complaining of? Breathing, pain.
Yeah.
My hip hurts. You turned me on my left side, but my left hip hurts. Well, guess what? I'm not going to stay on it for 2 hours. You're going to have to reposition me again. The position that I didn't talk about was, I don't know if it's their Sims position. It is. So while you don't give medications via the rectum, you don't give enemas, if I tell you, hey, I have to give this patient an enema, I have to give them a suppository, you need to go in there and pad that bed. And when you pad the bed, you leave them on their left side. When I come, I raise their right leg and their right arm, and I can give the medication. And then I leave the room real fast and leave them with the call bell, because now who's responsible for the rest of it? Don't look at me like that, Nicole. So hopefully they can hold it long enough for you all to bring that bedpan in the room. So we'll teach you the bedpan skill. But while you don't help with the enemas, if your nurse is coming and saying, hey, I have to give this patient an enema or suppository, she's telling you that to give you time to do what to the bed? Put those protective pads and everything on the bed. All right, so any questions about the positions? The other positions, I refuse to work in ER. So all the other positions, lithotomy, the rectal prostate position, if you work in an ER, you have to learn all that stuff. Y'all good? Who wants to work in ER? No one raised their hand. Okay. All right, so now the other half of the page discusses the vital signs. It may be hard to read, but I want everyone to say systolic.
Systolic.
So that's the top reading of the blood pressure. So the systolic has a range. And so that's when the heart is pumping blood through the arteries. And so that's the force. They measured the force. The range is 100 up to 140. If you see that, I want you to highlight it. So the range for systolic blood pressure is from what to what? 100 to 140. If it's less than 100, we call that hypotension. If it's greater than 140, it's not hypo. What would it be instead? Hyper. Everyone say diastolic. That's the pressure within the artery when it relaxes. So the systolic is when the heart's pumping the blood out, and after it pumps, it rests. So that'll be the diastolic pressure. I have 50 to 80 there, which may not be your facility's range, but your nurse usually doesn't care if it's within 50 to 80. So that's like normal for us. If it's greater than 80, well, maybe they're in pain. If only the diastolic is elevated, that could be pain, it could be anxiety, it could be mal discomfort. But if it's the systolic and the diastolic, that systolic's more important. If it's the systolic that's elevated, that's signs of true cardiac issues. So what do you do if your patient's blood pressure is 200 over 100? After you say, oh my God, what do you do? Call the nurse. Call the nurse. All right, what position? Where do you want this patient at? You want them up and walking? No. So where are they at?
They are in the semi.
Oh, look at, I was just going to say in the bed. She's giving us the whole position. They're in the semi-Fowler's position. All right, so if someone's blood pressure is high, what might happen to them? A stroke. So that's why we need to keep them in the bed, get that nurse in the room. Blood pressures, because I know everyone's afraid to do a manual blood pressure. So with you coming from another town, it may be a little bit harder for us. I won't teach you all manual blood pressures until you pass your CNA test. Let me tell you why. Because your CNA test in Florida does not require you to do a manual blood pressure. And you all are going to be so frustrated that you're not perfect at manual blood pressures until you will negate the fact that you are great at 21 skills. So I need you to pass your CNA test. It takes about 15 minutes for me to be one-on-one with you to teach you how to inflate a cuff, listen with a stethoscope. Now you know how to do manual blood pressures. What type of cuffs do they use in the real world? Is it manual?
No, the electronic.
The electronic, the automated blood pressure cuffs. So it's important for you to know how to place it. I have a sleeve on, so it may be hard to see. What's the difference between a vein and an artery? So why during CPR do we have you feel on the artery? What are you feeling for? Pulse. So an artery has a pulse. A vein doesn't. It's just spongy. So when you see that nice vein, that's where you want to put the stethoscope. That is the incorrect spot. A vein is for venipuncture. You're drawing blood. The artery is off to the right. So if you trace your pinky up to the break of your arm and press in, pinky up, you should feel the brachial artery. So with 2 fingers, and then press in. You can feel mine. And then sometimes you're not using your thumb to feel the pulse. I make like a clamp.
Okay.
So now clamp with your thumb, go under, and then press in because I'm a little fluffy.
Oh yeah.
Oh yeah, that's where your stethoscope goes. You look, if I can't laugh at myself, who can I? And now press in, because right there, pinky up. Press deeper if you don't feel it, because it's really. That's where your stethoscope goes.
Okay.
What's the name of the artery that's in the break of the arm? Brachial. Pinky up, and then use your thumb beneath to kind of like press in. You're gonna apply some resistance. Press in.
Yeah.
Okay, that's where the stethoscope goes. Perfect. Pinky up. And then use your thumb beneath just for some resistance. You don't feel it? Go up a little bit more. And you can use 3 fingers instead of, your fingers are so tiny. You use 3 fingers. It's there. Will you raise up for me? You're right. Where did it go? It's right there. Right there. Press down. Okay. Let's see how I can get over to you. Good. And press in. You have sometimes use your thumb beneath just for pressure and see how I'm fluffy? You feel it? Okay. Sometimes you got to press a little bit deeper. Good. And press in. I'm gonna be bruised, but I love y'all. So if you don't look away, it's kind of like surgery. So you want to be looking at it. And if you press too deep, you kill it. Feel it. Okay. All right. So the artery that's in the brachial arm is the what artery? Brachial. Okay. So you trace the pinky up. The purpose of you locating the brachial artery is because that's where your stethoscope is supposed to go. With your automated blood pressure cuffs, it usually will have an artery indicator. It has an arrow. That arrow means that it should be pointing toward the brachial artery. Otherwise, with your automated blood pressure cuff, you're going to get an accurate reading. So if the arrow's on the elbow, so a real world scenario is that my tech came out and said, hey, the patient's blood pressure is low. Trust but verify. That's what a good nurse does. So I go into the room. My patient's on his side. The cuff that has the blood pressure, the arm that has the blood pressure cuff on it is the arm that's up. And I remember that this patient's been in the same position for 2 hours. So this is the arm that's down. This is the arm that's up. What isn't flowing through this arm that's been up for 2 hours? The blood. So my patient's blood pressure was low because of positioning. Plus, when I looked at the cuff, the artery indicator was on the elbow. So if you don't go back and recheck, anytime you get an abnormal number, you're supposed to go back and check again, because it could be something as simple as you just laying the patient flat and then repositioning the cuff, and now you have an accurate reading. Okay, so if you get an inaccurate reading and your patient's stable, do you go and tell the nurse immediately? You're going to recheck, and if you have to, you recheck on the opposite arm. What are some reasons that you cannot use a resident's arm? Because there are going to be some patients you can't use an arm. They have an injury. Maybe they have a burn. What's another reason? She said they missing an arm. You are so right. You said they have an IV. Perfect. There is a device, and if your phones are on, I want you to go to Google. I want you to look up AV fistula. Fist, Fistula. 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 AV, then space, fistula. And then you're going to click on images. And Christian was like, whoa, what's that? And you click on images. So that is someone who has kidney failure. That is their surgically created dialysis port. That's their dialysis site. So when someone has an AV fistula, you cannot use that arm. If you see anything on the arm that looks suspicious, don't use that arm. Another time we can't use someone's arm is if they had a mastectomy. Why is that? And what's a mastectomy? Breast removal. You can't look at someone and know that they had a mastectomy because they could have had reconstructive surgery. So it's always asking, is it okay if I use this arm? Is it okay if I use that arm? And so for our scenario, a patient they have an AV fistula in their left arm. They have an IV in the right antecubital. As a CNA, where would you take the blood pressure? We can't use the left arm because they have an AV fistula. The right arm has an IV in the antecubital area. That's the bend of the arm. Where would you put the blood pressure cuff?
Above it.
If you go above it, you're going to blow it. So give me the opposite of above it.
Below.
Below it. And you can also put the blood pressure cuff on the calf. So your drop down menus, it's going to say, hey, where'd you take your blood pressure? Is it RUE, right upper extremity? RLE, right lower extremity? When in doubt, who are you contacting? The nurse. Because I think she'd rather you contact her in advance before you blow that IV. Give me a takeaway about blood pressures. What's the systolic range?
100 to
Diastolic range? 50 to 80. If the blood pressure is higher than the normal ranges, what is that referred to as? Hypertension. If it's lower, it's called. When someone's pressure is low, how are they going to feel? Dizzy. Perfect. When will I teach you how to do manual blood pressures? After you pass your CNA test. It doesn't take long at all. But you will know how to at least know your numbers. So on your test, you don't have to do a physical manual blood pressure, but you have to know your numbers. Pulse. Whenever we refer to pulse, we're talking about how fast the heart is contracting. So if your nurse had a stethoscope and she listened to the heart, she'd hear the heartbeat. And so the heartbeat and the pulse, they should be the same. So what's the normal range for an adult heart rate? 60 to 100. Go ahead and highlight it if you haven't done so. If it's less than 60, we call that bradycardia. If it's less than 60, we call it what? Bradycardia. Oh yeah, y'all learning some terms today. Brady, B-R-A-D-Y, cardia. Think of the Brady Bunch, all those people inside of whatever that vehicle was, a station wagon. It's not going too fast. If it's greater than 100 beats per minute, we call that tachycardia. So Brady is low, tachy is fast. T-A-C-H-Y. So bradycardia, tachycardia. What are some reasons that your resident's heart rate will be fast? Above 100. Pain, what else? A fever. So when someone becomes infected, if they have an infectious process, their heart rate can rise. What if they're nervous or anxious? What if they're short of breath? The heart and lungs, they go together. So they're having a hard time with oxygen. The heart's going to beat faster to try to compensate for that. Your respiratory rate, what's the range? 12 to 20. What's the prefix if something is low? Not hypo. What was the other one? We just learned it starts with a B. Brady. Bradypnea. So if someone's respiratory rate is less than 12, it's BRADYPNEA. And you got to add the dip in there. How do you pronounce it? Bradypnea. BRADYPNEA. What's the opposite of bradypnea? Use the T word. Tachypnea. So y'all see how hard it is to learn medical terminology? It's like tachypnea. So tachypnea. Huh? Yeah, watch the videos. Break it down. When someone stops breathing, we put an A as the prefix. So what word would that be? So like think of when someone is apnea. So they could have sleep apnea.
Oh, yeah.
So the prefix A in front of a word means the lack of. So A in front of the PNEA means that this person isn't doing what? Breathing. Oh, when y'all go home today, y'all heads go hurt. We got an hour and a half, about an hour, 2 hours left. Y'all are going to sleep well. When we get up, we'll be learning pulse, respirations. Temperature is not on your state of Florida examination. However, you do have to know the normal parameters. What's the parameter for a temperature? That's one number. 98.6 is one number. That was a textbook person who no longer exists. So what's the range? Okay, so we pretty much, if you say something from 97 to 99, during the pandemic, I checked everybody's temperature who came through our doors for a year. No one's temperature was above 98. Why is that in America? What do we get out of? An air-conditioned car. And we go into an air-conditioned building. So when you see that 98.6, that's probably not somebody who's sitting in air conditioning all day. So your patients, it's going to be rare that you have an elderly patient who's at 98.6. She might be at 97.8. Your oral temperatures, lift your tongue. Where does the probe go?
Underneath.
The front or the side?
In the middle.
The side, where the large veins are. All the way back there in that pocket. Why you, Alec? What are you thinking about?
I bit under my tongue so bad the other day.
Oh, how did you bite under your tongue?
I was eating.
All right. So I want to see if you can pronounce it. If you're taking the temperature under the armpit, how do you pronounce that word?
Auxiliary.
Take that U out. Auxiliary is a cord. It's an extension.
Axillary.
Axillary. Everyone say axillary.
Axillary.
You will not leave here after a 4-day class and be like, I took an auxiliary temperature. It is axillary. If we're taking the temperature in the rectum, which that's going to be rare that you ever have to do, you may have to assist a nurse. How much of my finger represents the thermometer probe? How much of the probe goes into the rectum? Just a tip. Okay, so worst maybe a ½ inch. But if you put too much in, you can perforate. You can go through their intestine, their colon. So you normally will not have to do a rectal temperature because you're not working with babies. Or you're in the ICU. That means this patient, they're just so cold until we have to go in and get a core temperature. Where's the most accurate route for a temperature? Most accurate route? The rectum. Why? Because it's not impacted by the environment. It's not, you can't. So we did that because this person was cold. Maybe they drowned. They were hypothermic. Maybe we have like a cooling blanket on them. So we're going to get a core temperature instead. And what's 2 other types of temperatures I did not discuss?
The tympanic.
Tympanic is where you take a temperature where? Ear. So that would be something maybe doctor's office, maybe if you work with peds, they have, and you put a cover on all this. You put your little ear cover on, put it in their ear, you press the button, it gives a reading. Also, the thermal, the forehead one will be another type. Most of your facilities are just going to have a probe, and you have to put a probe cover on top before you put it beneath the patient's tongue. Miss Lucas is drinking coffee, and you go in and you take her temperature. Her temperature is 100.5. Her previous temperature was 98.2. What do? Do you run out the room to come get me?
No.
You wait 15 minutes. Okay. Take the coffee. Because as soon as you leave the room, what is she going to do? She's going to drink some more.
Yeah.
Mr. Michael went outside and he smoked because these residents get to have a life. I don't care if you agree with them smoking. A resident in a assisted living facility, they can go and smoke. So he went and he smoked, and he comes in, he was sitting outside, and you take his temperature, it's 99.9. What do you have to do? Mm-hmm. If this person had a true elevated temperature, what would be a reason? That wasn't impacted by the environment. Infection. Where would an elderly person get an infection most likely? As far as it within their body, where is it located?
An elderly person.
Mm-hmm.
Where would they get it inside?
In their private, be very specific. A UTI.
Oh,
So not even a catheter. It's just from improper wiping or lack of fluids. So we try to not insert things in people's bodies. So this person was at home. They didn't have a catheter, but because they weren't drinking any water, or when they wipe back to front instead of front to back. They contaminated their urethra, and that's the tube that the urine comes out of. Whereas another organ that a patient could have an infection besides the bladder or urinary tract. We're almost at that season. You're about to make a lot of money because everybody gets these vaccines. The flu. So pneumonia, lung infections. So when you tell me that the patient has a fever, I'm automatically thinking urine, lungs, test, call the doctor. Who collects the sputum specimens? Not me. The CNA. So you don't have them spit into a cup. That first morning sputum, when they first wake up, we need a good cough. That's what goes into the cup. Urine specimens, there are collection devices that you can put in the toilet, or worst case scenario, you with your gloved hand have to do what when they're sitting upright? How are you going to get it?
For the urine?
For the urine, you have to catch it.
Oh, you mean
Yes, you have to catch it with a cup. You can do it, girl. You can do it. How do you get a stool specimen? What device do you use to transfer it from the collection device into the cup? A tongue depressor. So that little wooden piece of stick, we would take that to transfer it into the cup. Okay. So if you're telling me that a patient has a fever, just know what I'm about to have you do. Urine, sputum, stool. So make sure you check twice. And then lastly at the bottom, and then we'll go to our skills. If I can get you to read Christian, I know it's small. At the very bottom of the page, and there are like 4 or 5 bullets.
Wait approximately 15 minutes to recheck the temperature if your patient has eaten or drink or smoked. Elderly patients have lower temperatures. Monitor temperature changes closely with elderly patients. A 2-degree increase in temperature is considered a fever. Notify the nurse ASAP of any abnormal vital sign readings. Repeat any abnormal vital sign readings.
Perfect. And so they can hear it, may I read yours? Because I don't have one in front of me. All right. No problem. Now, it's going to be a problem with those elderly patients. They'll be like, Christian, we can't hear you. So if a person has a fever, you're going to wait approximately 15 minutes to recheck the temperature, especially if they have eaten, drink, or smoked, because that could falsely elevate the temperature. Elderly patients have lower temperature, so you're going to monitor temperature changes closely with your elderly patients. If they have a 2-degree increase in their temperature, so if their baseline is 97.8 and they go up to 99.8, we consider them as having a fever. Notify the nurse ASAP of any abnormal vital sign readings and report any abnormal vital sign readings. All right, no one look down at your paper. Blood pressure 110/78. Normal or abnormal? Normal. Blood pressure 92/62. Normal or abnormal? No. It's low. It's low. You're right. It's low. All right, you got me there. Blood pressure 140/78. It's on the high side, but it's normal. Yep. Because 140 is the high range for the systolic, and 80 is the high range for the diastolic. Some of your facilities, they have changed what the normal ranges are for blood pressures, but normally you don't see us treat or do anything until it's like 160/80, until it's a lot higher. What's your job? When in doubt, what do you do? Call the nurse. All right, let me get y'all some papers. We're going to start doing our vital signs. Do you mind taking one and passing one back? Thank you. Everyone has one? Okay. So before we go to the beds, I want you to find your own radial pulse. So in your packet, the pulse scale is on page 19. So on page 19, and we're going to backtrack and do gloves and hand washing. But on page 19, the scenario up top reads that the candidate is asked to take the resident's radial pulse, measured at the wrist. The pulse should be counted for how long? 1 full minute. A measurement form is provided to record the resident's pulse rate. The role of the resident is played by a person. So everybody, on your own body, the radial pulse is located at the wrist at the base of your thumb. So radial pulse, wrist, base of your thumb. Even though you cannot use your thumb to check a pulse, I use the thumb to provide some support. So I still clamp. Why can't you use your thumb to check a pulse? It has its own pulse. You can use 2 or 3 fingers when you're feeling for the pulse, as long as it's not a thumb. Is there anyone who's not found their radial pulse yet? Once you find it, you can release it, because I want to make sure you still have blood flow. All right. Looks like you're on the ulnar side. Okay, you're good. You're good. And you found yours. All right, so that was obviously your dominant hand. Switch hands, because the day you came to work and that hand has a Band-Aid on it. So I want to show you that whether your right hand or your left hand is dominant, you can use both of your hands to feel a pulse. There's no reason. If someone's pulse is irregular, during your test is not the time to try to diagnose them. We have too many young people drinking a whole bunch of caffeine, the monsters and everything else. You're not trying to diagnose them. If the heart rate is fast, the pulse rate is fast, you're going to count it fast. If it's slow because they took their Xanax that day, you're going to count it slow. You're not there trying to overthink the process. Before we go to the bed, let's talk about hand washing. We're going to end up going into the restrooms in a few moments to wash hands. I'm going to go and take off my watch for reasons we already discussed. Thank you. She's reminding me to pull my sleeves back. And I call this muscle memory. Everything that I do while standing, I want you to repeat, because when we go into the restrooms, you're going to do the same thing. First thing I'm going to do is take a napkin. I'm going to turn on my water. Take your napkin, pull it, and turn your water on. If you have a really fast stream of water, just cut it back some, because we don't want the water splashing. Now I want you to wet your hands slowly and deliberately. If you hit the sink, what must you say?
Correction.
So let me see you doing muscle memory. You're doing everything I'm doing. You're wetting your hands. Here, do you want to put it on my table? You're good? I can't, because you got to be there with me. We're doing this together. We're family. Okay, all right. So now that the hands are wet, I want you, and you do not need a napkin on the soap dispenser. I need you to get 2 to 3 pumps of soap. 1, 2, 3. Why? Because I don't know how well their soap lathers. What I do know is that if you don't have any suds on your hand, they're going to say your hands are not clean and you're going to fail your exam. So don't just get 1 pump of soap. Why didn't I get the soap first and then wet my hands second? So I can get the ladder. Otherwise, the soap runs down. Palms together. And in the real world, your hands, or when we're at the sink, your hands will be lower than your elbows. We're going to do the palms first. We're going to do 20 seconds of friction. After the palms, we're going to do the back of the hand, back of the opposite hand, from all the way from, there we go, all fingers too. In-betweens. In-betweens. I see you doing your own thing over there. Don't wrap yet. Just in between. Look at me. There we go. Around the wrist. Like you're grabbing somebody. Around the wrist. You did pretty, girl. You're. All right, I'm just going to do that again for muscle memory. Wet hands with soap on them. Palms. The back, all the way. The back of the opposite hand, all the way. In between. In between the thumbs. Around the wrist, as if you're trying to grab somebody. Around the wrist. That's what friction is. Now for the next 10 seconds, Alec is back there acting up. For the next 10 seconds, we're going to go up and down each finger. But I want you to see what's wrong with this. Act as if you're the nurse at the testing site. What's wrong with this? What didn't I clean? So it's not just the nail, it's the tip of the finger. So when you're cleaning the finger, it is all the way from knuckle to end. 1, 2. Go to the next finger. 1, 2. Wrap around. No loose fingers. 1, 2. Go, keep going. 1, 2. Friction. Rub it. Get it clean. Act as if your finger broke through a glove while you're giving someone a bath. Get the contaminants off. Alec, we want you to have some skin on your finger when you're done, dear. Good job. Good job. Once all 10 fingers are done, we should be at 20 seconds of friction, but we still have to clean our nails. So you're going to take the fat, fleshy part, go around the nail. Your index finger goes under. So around and under every finger. Around and under. Start with your thumb. Around first and then under. Around and under. Around and under. Don't try to do them together. Your nurse is watching everything you do. Around and then under. Around and then under. Why are we being so specific? Because if your nurse says that you didn't do something, she's always right. So if you do them at the same time, she can say, oh, for that one finger, you didn't clean under. So it's around, under, around, under, around, under. When you get through with one hand, repeat that process on the opposite hand, around and under. I'm so proud of you all. No one has on nail extensions. So proud of you all. If for some reason you happen to go to your test and you have those fake nails on, take them off. But if you can't take them off, you need to do an extra step. You need to scrape. Why can't we wear the nail extensions? Carry a lot of bacteria. When you're making a bed, it's horrible. You're trying to push things beneath the patient. Now you're poking the patient. Yeah. See, I love her. She's like, I'm worried about the patient. You can hurt the patient. Y'all are worried about looks. Those coffin nails are not for your jobs. Okay. So now we're going to rinse. Hands should be lower than your elbows. If your hand touches the sink, what do you say? Correction. The way you're going to prevent your hand from touching the sink is you're not going to move fast. So I'm going to rinse slowly and deliberately. The water's running. I'm going to scoop some water onto my wrist. Scoop some water onto my wrist. Why? Because more than likely there are some suds there that you can't see. Once everything is rinsed, I call this pretty girl dangle. This is not pretty girl dangling. What is that doing to the water? So pretty girl dangle. Now take a napkin. Dry starting where you're wet, but you cannot rub. You have to pat. Oh boy, I know you can do it. Once that napkin saturated, discard it. Get a new napkin. Repeat the process. How do you turn off your water? With a napkin. And then do you compress that napkin in your hand? No. All right, let's get ready to go into the bathroom. All right, so give me a second because I got to move this camera. I'm going to go first. Logan, I'm going to have you come with me also. Because you can open it up, because what's going to happen is at the end, we're going to separate. So some students will be with me and some will be with you. All right, so come into the restroom, everybody. I'm going to call you all in a moment. I hope you all are having a great day. Hey, hello. Let me get. Yes. Oh, no, we're going to stay live. Okay. Hopefully you all can see. Okay, everybody, you can come in. All right. And then Logan, I need you over here also. Come on in. Come on in. Come on in. Come on in. So probably most over there is 3. All right, good. And then Logan, you'll stand there and watch. I want to make sure y'all can see. So you can come over here a little bit. You come over here. You come over here. And then Logan be good right here. Okay. So I'm going to pull a napkin. What comes next? Wet. I touch the sink. What do I say? Correction. Don't shake. Just pretty girl dangle. How many pumps of soap?
3.
What do I do now?
Rubbing your palms.
How many seconds? Good job. Palms. What comes after palms? What comes next? What's next? And so if you go out of order, our videos go always in the same order. So if you go out of order, it won't fail you. I just want to make sure that if you don't have soap from your, add more soap there. If you don't have soap from your wrist to your fingertips, don't proceed to your fingers. Now, how do I clean my fingers? Okay, and pull and go all the way from the top to the bottom. And make sure you all get 2 real pumps of soap because I don't feel like I have enough soap. So what would I say during my test? Correction. I'm going to start over here. I'm going to add some soap. Now, for classroom purposes, I'm not starting all the way over again. I just want to let you know what it looks like when you have sufficient soap. Now that my hands are clean, what do I clean last? Okay. And what's wrong with this right here? Because she can't see, right? So we're going to make it really obvious so we can pass our test on our first attempt. Around, under. What's wrong with my uniform? Oh, I can't get away with nothing around y'all. Okay. So correction. And now I'm going to rinse. And rinse. What kind of dangle is this? Pretty girl dangle. All right. So because I paid a water bill, I'm going to turn off the water. But you all can keep the water running. Should I compress this napkin? No. Where do I start drying?
Your wrist.
Wrist. Rub.
No,
Pat. And I didn't tell you why you don't want to leave the napkins particles on your body. I'm just going to pull two. And if your skin is still glistening, that means that your hands are still wet. So make sure you keep going until your hands are dry. And now you're clean enough to go glove up and go take care of your resident. All right. So they can't see you all. They can see your hands. I'm going to stay here. The bathroom next door is a little bit smaller. So can you just take these two ladies with you for now? Okay. And Logan's going to watch you. Who's going to go first over here? Oh, I see. Christian. Go ahead, Christian. Can you see, dear? You can come over more. Okay. The hot water gets really hot, so be careful. Is your uniform touching, Christian?
Yes, correct.
Now we're not that cheap. You can use a little more water than that. Good. Too good. Step back just a little bit. There you go. Hands should be lower than your elbows.
Like this.
Yes. Mm-hmm. Don't forget to go in between. That's the only thing you miss. Go in between your fingers and in between your thumbs. And then you can proceed to go up and down each finger. So you don't have to be perfect, but I recommend that you just keep a pattern so it becomes second nature. Up and down like you have something, really clean it. Friction, clean. 1, 2. Let's go to the next one. 1, 2. Go to the next one. Great job. Oh, you ready to pass your CNA test? I see that, Miss Christian. Are you going to work with babies, kids? What are your thoughts?
I want to work with labor and delivery.
Oh, wow. And I just want to say, be careful being so specific with labor and delivery because sometimes those are like the hardest spots to get. And you see soap on your wrist, so how are you going to get it off? Beautiful. So if you just need to get a position until you can get where you want to be, like med surge. No, ma'am, that was not pretty girl dangle. All right, corrections. All right, what are you correcting? Awesome. You can proceed to your napkin. Great job. Give her applause, everybody. Woo! All right, so Christian, you're in charge while I go next door and check on them. So I'll be right back. So Christian, you're right here. Next. Okay, all right, so you're good. All right. I'll be right back. Y'all good? Okay. Okay. Because I'm not talking. All right, everybody, I'm back. We see you, Miss Deborah. Oh yeah, those hands are clean. Lord, she's showing out. Uh-huh. And so you can go longer than 20 seconds, but remember your test is timed. And so it's 20 seconds of friction. The whole process takes about a minute. And what's your question, Nicole?
When, I was just telling about, I know I'm transitioning, like coming from culinary to here, especially when it comes to hand washing. That's what.
Okay, baby, rinse.
So
did you do your nails yet?
No.
Okay, stop washing. There we go. I want you to go.
Ready.
Sorry, I gotta focus on her because that nurse, you do your nails because that nurse is probably like 45 seconds in. Like, her, you've done enough friction. What's your question, Miss Nicole?
Especially when you do the fingers, because I'm so used to, when you wash, and everything, and you do this back of your hands, always.
That's not going to pass or fail you.
Okay.
It's just different than what we're teaching, but you're still getting the same thing accomplished.
Okay. I just want to make sure I do it.
No, something like that, because you're still going in between. As long as she can see that you're going in between your fingers. Okay. All right. Miss Deborah, our future nurse, she ready. And then this time pull 2 napkins because they're pretty thin.
I knew a little fast. Exactly. Move out of the way. All right, ladies. But I know they need to be totally dry.
Yeah. So
No
next time
listening.
you can pull 2 napkins.
Okay.
You can pull 2.
Okay.
All right. Applause. All right. So I'm gonna go back check next door because I may call you next door, Nicole. Okay. Logan, do you have time for one more?
Yeah.
Okay. All right. So Nicole. Right, yep, they're ready for you next door.
Just like doing it while I'm at home.
Yep, you gotta practice a few times a day. I like to say practice wherever there's free water. So you go to a restaurant, you go to school, like, hey, you know what? While I'm in here, I'm just gonna wash my hands the CNA way. Good job. Have you applied to nursing school yet? Have you decided which one you want to apply to?
I will definitely do FCCJ.
Okay. No, and I don't know if you feel like traveling, but St. John's is in Clay County. They're not that far.
I would love that. I'm definitely, because I got a plan like 6 months of this.
Good.
And then on to the next.
Yes,
you said St. John.
I think it's called St. John's River Community College.
Yeah,
I think it's
years
college.
ago I lived in Worldcroft Village, so
Yeah.
okay.
So look that one up too. Now I'm not sure if they have a CNA to LPN bridge program, but it's worth just asking. And it's a really good college.
How far in advance should you apply?
I
as
would
soon as possible?
I would start making contact. That way you can figure out what's all needed. So these next 3 to 6 months, you can make sure you have, if they require a pre-test, any type of nursing entrance exam, you've already done that.
Okay, because I called a school and the price difference.
I see soap on your wrist. Look at the back. Look at the back. You see it? There we go. Now you got it. Yes. I now pretty girl dangle with your hands again. There we go. She's like, she watches everything. You weren't supposed to be watching. You were having a whole conversation. Good.
That's what I was wondering too. If we could, did I turn the water on first? I did.
It doesn't. It won't pass or fail you.
Okay.
It will not pass or fail you. I turn it off first because I pay the water bill.
Amen.
You all do what you need to do.
Amen. I understand that.
Great job, team.
Yeah.
All right, I'll meet you all in the classroom, and now we all need lotion, right? There's some lotion up front at the station. Okay, no problem. No, you're fine. No, I was just gonna take care of the trash. Do you mind taking care of the trash before? Thank you. Just push it down. And you all are welcome to have a seat just for a moment. Tim, are you at a point where you can put this camera up here? Thank you. Got to slide it. I don't want it to cut off. Thank you. Comments okay, Jay? Do you all need lotion? Okay. Okay, are we back on, Jalen? Got to be careful. I think we're pressing. Okay, are we back on, Jalen? Got to be careful. I think we're pressing something. Okay, I think that's stable enough. All right. Mic check. Can everyone still hear me? Would you like some lotion? Okay. You're welcome. And then Logan, you know our little phrase. So figure out something so y'all can get us some registration. So it's wonderful having such a small team who we work together so well. All right. So you're in a facility and you have just washed your hands and your hands are dry. You okay, Jay? No, we're gonna go over there next. And you decide to put on Victoria's Secrets or some type of fragrant lotion. What are you doing to your hands? Not just contaminated, it is going to eat your skin. So your facility has approved lotions that are usually hypoallergenic, or you're going to have to get you some hypoallergenic lotion. If it has a fragrance in it, plus with all the chemicals you're using in your facility, your hands are going to become really dry. Whenever you are, when your hands are really bad, what could you do with some Vaseline or petroleum jelly? Put that on at night and then maybe put like some mitts or something on top of it. Hopefully you don't experience that, but once you do, it is quite painful. You all are welcome to stand. Remember, we have a camera there, so your back will be towards the camera. You're going to come over this side. We're going to talk about the layout of your room. I'm going to cut on some air for you. I'm asking you to get one more thing for me. If you'll get your index card, which is going to be your documentation form, and a pen. Okay, I'm switching mics. Jalen, would you make sure everybody can still hear me? Okay. I'm going to miss you tomorrow, little buddy, while you're in school. Dana, thank you for what you're doing also. All right, so y'all don't have to stand that far away. Just kind of like come over here, but your back will be towards the camera. So they won't be able to see you. I just want to show you the layout of your room. So when you enter your room at the test site, so we have two parts. We have the written test, which is on a computer. They call it written in case the computers crash. But if the computers don't crash, you're taking it on a computer. It's multiple choice. 60 questions, how many minutes? 90 minutes. You don't know which test you're going to perform first. It could be the written test or it could be the clinical test. If it's the clinical test, the nurse is going to call you randomly, you and another partner, into a room. They have to show you the layout of the room before you ever know what skills you're going to perform. So we're going to do our little walkthrough now. We have our bedside tables. Whenever you're working a bedside table, there's a lever that you can use to lower and raise the table. When you're lowering the table, you'll be lowering this over someone's lap or their leg. Use your hand as a buffer. And whenever your hand touches their leg, you stop lowering it. Otherwise, your patient is going to be very theatrical and they're going to be like, ouch, you hurt me. But it was just a table. So be very careful when you're lowering it. Our beds are semi-automatic. At the very end of the bed, there's a crank. I don't want you raising the frame of the bed at the test site. Whatever height you find the bed is the height I want you to leave it at. But let's say you're taking care of a patient in the real world. If you crank that bed up, when you get through cranking it, if you leave this handle out, what have you just created? A hazard. So when you get through cranking it, you have to put the handle back up. Semi-automatic beds mean that you crank it to elevate the height, but then they have controllers for the rest of it. So, and sometimes it's hard. So don't look away. You look at the patient and you look at the actual handheld device. Head up, head down. Center section up and down. And then lastly would be feet up and down. This is our simulated button, call bell. Let's say you have a patient who is blind. There's actually Braille on here. So you can have them feel. Your facilities may not let you do this, but worst case scenario, you can take like an electrode for the heart monitors. It has a little metal prong. You can attach one of those to the nurse button. That way, if they can't feel anything else, they're going to feel that prong sticking out so they know how to call for help. Side rails at the test site are optional. You are not tested. You're not passed or failed on the absence or presence of side rails. So if side rails are there, great. If they're not there, also great. This one, and I'm going to have everybody come and work a bed. This one is just a pull up. And then there's a white lever that you'll use to lower it. So I'm going to do the same over here so this side can see it. There's a white button right here that you'll pull to lower it and then pull up. So correction. So if we had a patient in the bed and you lower the rail, what must you do before you leave that side? Pull it back up. Okay. Brake should automatically be locked. We have a brake here. In between your beds, there's going to be a cabinet, and the cabinet's going to have various supplies. So on top of this, we have gloves. Our gloves are latex free. If you have a latex allergy, usually we don't provide latex gloves at any facility. They probably won't have hand sanitizer at the test because you can't use hand sanitizer. We have different soaps. We have our water pitcher. We have alcohol swabs. Inside of the cabinet are our supplies for our ADA skills. So I'm going to move over this way. So inside the cabinet are the supplies for the ADA skills. What does ADLs, what does it stand for? Daily is right, assisted isn't. Help her out, team. She's not the only one. So activities of daily living. So ADLs, everything you did today in order to get here. You brushed your teeth, you got dressed. If a resident or a patient doesn't have a deficit with an ADL, chances are you don't have a job because you're there to assist them with doing something. They do not keep it neat. Everything is kind of like thrown in there. So you're going to have your bath basin. You're going to have your toothbrushes, your toothettes. What's a toothette? It's a little sponge. You use the sponge on a person who doesn't have what? Teeth. All right. So so that'd be like your denture care skill. On the lower shelf, you have your bedpans and anything for output. What's the difference between intake and output? Intake could be water. What else could be intake? So not just fluids, food. So whenever you document your feeding skill, you'll have to document the food and the fluid intake. Your nurses may not require that you document this, but IV fluids, because that would be intake also. What would be output? Poop. Okay, what's the medical term for poop? Stool. What else? Fecal, bowel movement. So urine. What else? What are some other types of output? Vomit. What's the E word for vomit? So this basin, correction, this basin is an emesis basin. So what's another word for vomit? Emesis. If someone's going to vomit, do not give them the emesis basin, because what's going to happen? So I don't know why they called, maybe back in the day they vomited cute. I don't know, but now it's more projectile. So if someone's going to vomit, you give them the bath basin, let them put their and everything, and we have to measure that. Why are we measuring output? To see how much comes out, because if they have more going out than going in, what's that word? Dehydration. I think we missed one type of output. Think about a surgery. What's another type of output? Blood. So when you're emptying those surgical drains, we still have to measure all of that also. How often do you document your intake and output? Every time. We like you to document in real time. So pretty much every time a patient has a picture at their bedside, and all the cups, so all the cups are standardized. So it'd be like 8-ounce styrofoam cups. You don't ask them how much they drink out the pitcher. What question do you ask instead? They have a cup there. How many cups did you drink? And we'll teach you how to do the conversions, because the cups are ounces, but we have to convert everything to mLs or cc's. So it's not something you have to worry about right now. Your facilities usually will have cheat sheets, and it'll be like a conversion. It'll be a bowl of soup is 8 ounces. It'll say 8 ounces equals 240 cc's or mLs. We have to do it in the smallest quantity of fluid. So we don't say, are you okay, Jalen, with the mic? So we're not going to say someone drank 8 ounces. It'll be 8 times 30. That would be 240. What's above each bed? A clock. Your nurse is also going to ask you at the test site, would you like to see, especially if it's your skill, would you like to see the gait belt? Would you like to see the wheelchair? Would you like to see the drainage bag? What should your answer always be? Yes. Because if she's asking, that means that either you or your partner will be assigned that skill. But you don't know your skills yet, because she won't tell you the skills until after the tour. One bed is dedicated for a mannequin. So there's going to be a mannequin in the bed already. So at the test site, it's 2 beds. One's going to be for the human, one for the mannequin. There's also going to be a chair. Any questions before we proceed? Sorry, dear. Because you brought the easy shoes, can I get you in a bed, shoes off inside on top of a bed? You get to take a quick nap. Who else has on some shoes that are easy to come off? Because we need patients. Remember, at the test site, you have to portray, you have to be in the role of a patient. So classroom, you have to be in the role of a patient. All right, I'll lay this. All right, so the faster we move, the faster we can do the skill. Everybody go end up getting in the bed. It's not like, thank you for volunteering. There, you can come back. Okay, let me get your bed up. So this one, the handle is broken, but I promise just follow the cord and you'll find the controller for this bed. These are just regular rails that I bought, so these don't come up and down. I actually bought this for one of my surgeries because I had a high bed, and I was like, you know what? I need some rails for home. Then I'll show you how to use the rails over there. All right. May I take your card? Shoes are a fall hazard, so I want you all to watch what I do as I walk around. I'm putting my residents or my patient shoes beneath the bed because I'm walking around. What should I do after I'm done on that side of the bed when I'm done with my skill? Pull their shoes back out so that way they don't have a reason to walk without their shoes. What type of socks are appropriate for a medical facility? The skid. And so he has on the socks with the skids on the bottom. Sometimes they twist. Before you get them up, make sure the skids are always on the sole of the foot. Sorry to reach over you. Would you please get the call bell? I'm being rude, and I was not trying to be. There you go. There you go. Sorry, the curtain's way over there for that side. Or you can touch that the accordion door over there. When I knock, I want you to say, "Come in." Hi, good morning. My name is Eunice. I'm your CNA today, and I'm here to take your pulse. Is that okay? Before I begin, I'm going to go wash my hands. And everyone here knows how to wash hands. So whenever you tell us that you're going to go wash hands, our response is going to be, hands are clean, because we've done the hand washing skill. For your test, that's never going to be the option for your first skill. If the nurse allows you, that's going to be your second or your third skill. Okay, so my hands are clean. Now that my hands are clean, what do I need to touch? Curtain, and this curtain only closes halfway. Okay, curtain, what else? This is the pulse skill. What else do I need to do? What's in her hand? Call bell. I'm going to remove that. Is it okay if I take this out your hand? All right, awesome. What does HCC stand for? All right, so do you mind putting your card down and doing the same for her? And that's your curtain over there. The blue one right there.
My name is Alex. I'll be your CNA today. It's okay if I come in and see you.
Don't touch anything. HCC. You got to wash your hands. Got to start all over again. So don't even get close to them until your hands are clean. All right. Mhm. Okay.
Hi, my name is Alex. I'm going to be your CNA today. It's okay if I see you.
You want to be specific. You have to list a skill. So the skill is pulse. I'm here to take your pulse.
Pulse today, okay?
Let me go.
Wash my hands.
Everyone tell her hands are clean.
Hands are clean.
Good. Now you can touch whatever you want to touch. At the test site, you start knocking at the door, but you're inside the room. Just a little, because it doesn't close all the way. Good. We saw you, girl. Yes. Great job. And you can put it on the shelf in the center. So what I'm going to do now, ladies, is I'm going to 1, 2. Can I get you in the center of your bed? We're not supposed to sit on the beds, but for classroom purposes today, we're going to have at least one person sit on a bed. Can I get you to sit on the bed facing the clock? You're going to sit on the bed facing the clock. Can I get you to sit on this bed facing the clock? Can I get you two ladies to pull up a chair and go on the opposite side of the beds? A chair behind you also? It doesn't matter which chair. They'll all go back. Facing the clock. Okay, and you're going to be on the opposite side. So you're, it'll make sense in a moment. Yes, ma'am. Yes, because you want to get access to her wrist. So everybody, you want to be close enough within proximity to get to her wrist. So when you're taking your test, and you can put your papers up here. When you're taking your test, your nurse is going to be counting the pulse at the same time you are. When you're done, you don't call out your number because you don't have gloves on your hands. You go ahead and you document immediately. Now, this is just for classroom purposes, so I just want to make sure you feel something, and then we'll perfect it probably the second attempt. So I'm going to pass around sanitizer, and then once everyone has sanitized, I want you to ask your partner, is it okay if you touch her arm? And then you'll do the same over here. Once everyone is sanitized, you ask your partner, is it okay if you touch your arm? All right. And so one hand is going to support and one hand is going to feel for the radial pulse. And where's the radial pulse located? At the base. Is that, do I need to let that rail down? Is that uncomfortable? Okay. All right. How are we doing? And so it's on the thumb side. So you're on the pinky side. It's on the thumb side. And you can rest her arm. You're just putting one hand beneath it. And it's okay. You got it now? So do you both have it? So she's the nurse. You're the CNA. Look at your nurse and say, do you have the pulse?
Do you have the pulse?
All right. You're the nurse. And then you may want to switch hands, Miss Karen. Did you find it? You have it? Okay.
My pulse on this arm is a little hard.
It's a little hard to find? Okay. You're good. You're good. You're good. And the technique is to bring the hand back a little bit. My God.
It's definitely hard to find.
Okay. Pause. Hey, Jalen, you mind taking off your shoes? Take off your shoes and come over here. I'm sorry, patient. We're not going to do her like that because she's just learning. All right. So, ladies, for right now, just pause for a moment because we're having a little difficult over here. The young patient we choose doesn't have a pulse in her left arm. All right. So, if I can get you to stand up, and then you'll go ahead and step out, and then Jalen will.
Switch.
Yep, you're going to switch. Oh, yeah, they can feel that. Jalen. And then would you give Jalen some sanitizer? And you can get you a quick nap. You just lay back.
I'll ask you to fall asleep.
You may fall asleep. Okay, all right. Uncross your legs. All right, and so scoot over just a little bit so she can feel in the bed. Test site, your nurse will probably be the one sitting in the chair, so you'd have to stand or squat next to the bed. All right, so now let's make sure they're ready, and then we can get you all back ready. So you'll ask, is it okay if I touch your arm? Okay. All right, so one hand supports. All right, and one hand. So think of a patient who wants to pull away. If you press too deep, you're going to kill it. So you don't want to be too deep. Right. Do you? So now you're the CNA. She's the nurse. Say, nurse, do you have the pulse?
Nurse, do you have the pulse?
Okay, and so we have the red hand that's moving. That's the second hand. I want you to tell the nurse we're going to start on 4.
We're gonna start on 4.
And you'll count the pulsations you feel against your finger. Okay, over here for 1 full minute. So, would you like to see the pulse?
Nurse, do you have the pulse?
Right, and so for this one, let's start on the 8. Can you all see? Because her hair. Right, once you're done, just pick up your pen, write capital P, and then the number you counted. If you lost count, it's okay. We'll do it again. Shh. Right, when you're done, just write down your number. Capital P, what does that P represent?
Pulse. we missed the.
All right, so very good point. So they missed the cutoff. So at the test site, your nurse is going to sit there for as long as you sit there. So this would be your last time. You have to remember your starting point and your stopping point. And it's the last time so that our other two students can practice. So go ahead and go. As a matter of fact, can I get you to step back for a moment? Can I get you ladies to stand up? Can I get you to step back? Can I get you all to stand up? You go to her. You go all the way around. We're going to switch patients. Musical patients. Everyone sanitized before we started. So, and now you all are going to come over here. And then what's going to happen is at the end, you're going to partner with Jalen also. Okay. All right. All right.
So do we need to sanitize again?
You're good. You're good. Everyone can wash their wrist.
Okay.
All
All
right.
right.
So,
So go ahead. We're gonna do it again.
yep. And now you're finding. So when you're practicing at home.
Oh yes. Do you mind if
All right. So when you're so far back, when you're so far away, just come a little bit more. So artery goes this way. So finger too. It's deeper. Only pressing with one finger. Line those fingers up. Finger is bent. No space. So you want to be close to the base of the thumb, not way down here. Okay. Let me add your partners next. All right, team, how we do?
So I got 72.
Give each other a high five. Great job.
69. And I have okay. Then mine is 66.
All right, put a
Not
P in
bad.
front of it. Okay.
Mine came up to 66.
Okay, and so for your test, during the pulse skill, you can be 4 away from your nurse's number, but your nurse will never tell you her number.
Got it.
Okay. And so if you lose count, what do you say?
Correction.
Correction. If you feel like you have the weaker wrist, you would ask the nurse, could you switch sides so that you get the best wrist? I've never had somebody who didn't have blood flow who was young on one side of their body until today, but we were able to switch out. But I mean, you can tell the nurse, look, I'm just not feeling anything on this side, and you take the stronger side. It's not always that the right side, the left side, the side with the heart is going to have the best perfusion. So you would think the heart's on the left, that's going to be the one with the best pulse. It's not always the case. All right, Jalen, I know you're going to be heading out soon, so thank you for all your hard work. Take that computer with you, wash your hands, put on your shoes, and I will get in the bed for Jalen. Everyone else, I need to let our last two students partner, unless one of you all want to get in the bed. Thank you so much. She's like, I want me a nap. No problem. No worries. What were your beats per minute? I think they said 70, 68.
57. And the second, yeah.
And then I had 66.
Okay. So that means you're well and healthy. So the more athletic you are, the lower your heart rate.
Oh.
Your condition.
So are dead people really athletic?
Dead. I didn't. Well, I mean, like, that's my son, y'all. All right. So y'all ready? If you all want to take a quick break, you can. Or if you want to practice, you all can practice at a table over there. Whatever you all want to do.
Yeah, because
I just got to make sure that they practice. If you all are now the senior CNAs, go over there, do whatever you're gonna do. Oh, look, now you don't want you don't want to be so we don't have to go through the introduction for this one, but you don't. All right. And so remember, now you're crossing over. You don't want to cross over. Bring her wrist, rotate, get those 3 fingers together. But ladies, shh, see how the senior CNAs do, y'all? They got 10 minutes more training, y'all, and now they over there all loud. So always on the thumb side. Press in. All right. 3 fingers if you need to. You can do 3 fingers, just not the thumb. All right. So now you're the CNA, you're the nurse. Ask the nurse, do you have the pulse? Look at each other, eye contact. You can take everything with you, take it home. All right. What number are you starting on? You did the video, right? You did the video already? Okay, take it home.
What is yeah?
Cut out the parts where text me. Take the computer. Put your phone up. Perfect. You got to watch the clock, Christian. Go ahead and write down the numbers that you received. Remember at the test site, the nurse won't give you any heads up. So you have to, you're not staring at the clock, but make reference to it about every 15 seconds. Just peek up. All right, so we got P65 and P69. Give each other a high five. All right, now switch sides. Let me get out your way. Beep, beep. It kind of felt, she said,
It's like that side started like slowing down a little bit.
maybe she started resting a little bit.
Is it okay if I touch
And all right, Jalen, have a good day, dear. You can leave it open. I'm hold up. I'm gonna call it that pretty girl finger. Until you're good at this, 3 fingers. You feel anything? It's because you're too far over. It's here, and your fingers are there. It's here. It's here. Press in. All right, let me make sure your hands are in place. Maybe switch hands if that's uncomfortable. And then I told you to use that thumb for support. So use your thumb beneath that support. It's kind of like making a clamp. Okay, and you can lower her arm some and come closer to the thumb. And use 3 fingers instead of 2 until you're good at it. Okay. See what you all have. All right. All right, so great job. All right, so if you don't mind just moving that chair back for me. All right, so ladies, we're gonna, oh, you're still in the bed for a moment. We're gonna finish up. So come on back over, cause now Nicole, it's on you. We have documented the heart rate. Would you HCCD? Because I heard y'all over there talking about it. And then just verbalize everything you're doing.
And I'll have to go through and do it.
All right, so she just documented
Um,
whatever name, because you just met her. She's at the test site. Make up a name.
Miss Smith,
So you did a C and a D. Call bill and documentation. What else do you have to do? There's nothing to correct. At the end, the order doesn't matter
okay.
because you didn't have on gloves. So just get it done.
Oh, okay.
It's back there behind you. Go on, take them steps. Go on, walk on over there. I know it's annoying.
No, you're fine. Okay, I got
Good. Hands are clean. Stand at that door for 5 seconds and say what 4 letters while looking at the room. And what does HCCD stand for, everybody? Hands, curtain, call bell, documentation. Guess what, Nicole? You're done with your skill. All right. So let me set it up so that a few more people can run through their exit. We'll just let one more person run through, and then from there we'll go to respirations. If you need to take a quick lunch break, you can. If you can power through, we got one more skill, which would be bedpan, and then you all can just get out of here early. Y'all said, which one? All right, so I'm putting this. All right, so who wants to go next? It's just the exit. Go ahead, dear. You don't want? Okay, go ahead.
I don't know why I'm feeling like radiant black.
And so with bedpan from start to finish, we do intro to exit.
Okay.
Okay. Good. Whatever name. So remember at the test site, you never met this person before. Good. Call out those 4 letters. Very good. Hands are clean. All right. And then before you say done, just recap everything.
Document.
And you did that already. Great job. You did everything. So I have little notes around trying to, remind you. But the HCCD, so when you come into a room, it's HCC. And then at the end, even though I don't have HCCD there, it has the order. The order when you're ending your skill isn't as important as you doing everything. So if you had gloves on your hands, because maybe you emptied the drainage bag, what would you have to do before you picked up your pen and documented? Take the gloves off and wash your hands. Because this was the pulse skill, you can go immediately to documenting. Great job. You're now discharged from the hospital. Okay, go ahead. You're released now. And now I will be the patient. It's fine. We'll wash the sheets. You breathe, young lady. Respirations. Okay, I'll wait for her to put her shoes on, and then we'll talk about respirations. Oh, I wish I could do that. Put my shoes on while standing up. Oh, enjoy your youth, young lady. You have to work this evening?
I have to go to work right after I leave here.
You're ready for the healthcare field. You just got off? All that energy. You ought to see how she's looking at you like, Lord, you just got off of work. She's going to work. Get you a little nap in the car. And then, Christian, how are you doing without your son? Yeah. Is this your first time being away? He's 4 months. So have you gone to work? Okay, good. All right, so everybody, for respirations, 1 breath in, plus 1 breath out. So we're taking in oxygen, we're letting off CO2, letting off the waste. So it's 2 movements that makes up 1 breath. So when you're counting, you're either counting when the chest rises or when it falls. You don't count both. If someone is flat chested and they're laying flat in the bed, the best thing to do is to sit them upright some, because then you can see their abdominal muscles move. You all are going to be counting my respirations at the same exact time. It's going to be a clock above the wall, above the bed. Of course, at the test site, it's just going to be you and the nurse. The nurse may hold the resident's wrist, but she's not counting the pulse for the respiration skill. Why is she holding the wrist? So that I don't know that she's counting my respirations. So during the respiration skill, if your nurse is holding the wrist, do not get tricked. She's not counting the pulse. What is she doing? Counting the respirations. You can't tell the person you're counting their respirations. Why? Hey, Miss Eunice, I'm gonna count your respirations. Yes. So instead, we use a blanket term, vital signs. So if your paper says respirations, you never tell them respirations. It's hello, Miss Lucas. I'm Eunice. I'm your CNA today. I am here to do your vital signs. Is that okay? I get to go to sleep. All right, all y'all gather around so you can see. Good night. Y'all know about the clock, so make sure everybody can see the clock. One of you all decide what number you all going to start on, and then at the end you put capital R on your paper, and then write down the number that you counted.
Y'all want to start on 12 or 1?
Okay.
We don't do all the introduction.
Not for this one. So for classroom purposes, at the test site, you have to do an introduction for every skill. But during the class, if we did that, we wouldn't get out of here.
Right.
So I'm going to go back to sleep now.
Okay. Y'all want to start? We can start on 5.
All right, capital R and the number that you counted. Don't let your partner see your card. Top secret. All right, so I'll teach you something after this, but based on where you're standing, your number's going to be different. What number do you have?
17. 17. 17.
So what I recommend is during your test, you either stand directly next to your nurse or directly opposite your nurse. So your numbers will be like the same because you have the same viewpoint.
Yeah.
But for this skill, you can be 2 away from your nurse's number,
Okay.
and you all were between like 16, 18, 17, 19. So great job.